Everyone to the latest webinar with Cosmetic Laser Dermatology. You are joining today with Dr. Kimberly Butterwick to talk about tumescent liposuction and fat transfer. We are very excited for this webinar because this is definitely a big expertise of our practice, of Dr. Butterwick especially. And a lot of people come into us because, they're interested in sculpting or contouring. And, sometimes there may just be an area you don't like. And whether it may be in your abdomen, your love handles, thighs, buttocks, or even your neck and jowls, tumescent liposuction is an incredible procedure that can help. And Dr. Butterwick is going to speak with you about it today. This is live, so we do have time for open question and answer at the end. So feel free to input any questions you may have. And we will also be announcing the winners of this webinar at the end. So please stay on. So without further ado, let me just introduce you to Dr. Butterwick. If for some reason you don't know her, Dr. Butterwick is an amazing board certified dermatologist. She is one of San Diego and even actually one of the country and even the whole world's leading authorities on injectables, fillers, lasers, and liposculpture like we're talking about today. She's definitely known for her very comprehensive examinations and her meticulous techniques and artistic eye, and of course, the results. She has authored or co-authored more than 35 peer-reviewed articles and 19 book chapters. She's been a part of 60 clinical studies, 60, and has given over 400 academic presentations. And many of those are about tumescent liposculpture, which is what we're talking about today. And Dr. Butterwick actually was one of the first people to participate in a US workshop for liposculpture in 1993. And she has had extensive experience with thousands of patients and has several of her pivotal studies have really, served as the standards for the best care for liposculpture today. So, one last fun fact about Dr. Butterwick. She was also ranked number 5 in the entire country of cosmetic dermatologists by Newsweek this year. So we are so proud to have Dr. Butterwick as part of our practice, and I'm excited for you guys to hear from her today. So Dr. Butterwick, take it away.
Well, thank you very much, Risa. That made me feel good. And tumescent liposuction is something that I've been doing for close to 30 years now, I guess. And it's a procedure I love. And so I want to share it with you tonight. And while we're doing the liposuction, why not recycle and be ecologically minded and use that fat for a good use, like placing it in our faces and other areas. So we'll talk about what we can do with the fat. And so without further ado, we'll get started. These are my disclosures, which have nothing to do with what I'm going to talk about, but it tells you that no one's paid me to say anything that I'm telling you today. This is kind of my honest opinion based on the literature and my years of experience. So let's talk a little bit about body sculpting in 2023. Is it still popular? Well, yes, it is. And there's been a real renewed interest in tumescent liposuction ever since the pandemic. A survey showed that there's been a 40% surge in all plastic surgery procedures, including liposuction. And I think part of that is that we stayed home and 40% of Americans gained weight, darn it. And now we want to lose it. And we don't want to lose it over a year. We want to lose it now. So there's people want to get things done that they've put off. And I think the pandemic kind of taught us that we should just kind of take advantage of the times that we do have and make good use of our time. So it seems to be what the country's thinking. And whenever we do a survey for the American Society of Dermatologic Surgery, if we ask consumers, what do you care most about? Excessive weight is almost always the top concern. And we just tend not to like our bodies and we wish we were a little thinner. Now, we have a lot of different ways we can remove fat, and non-invasive body contouring procedures have been very popular pre-pandemic, such as cool sculpting or sculpture. There's several non-invasive. There has been some negative PR about this, but I tell you, if you go to a very safe place like our office where everyone is very experienced, everyone is super trained, I do think non-invasive body contouring is still excellent, an excellent solution for small problems. But if you have bigger problems, and I'll show you in more detail, with liposuction, just one treatment and you can fix things very safely. And that's why till today, tumescent liposuction or liposculpture, we like to say, because it's a very refined procedure, it's the gold standard for body contouring because it's so effective, it's so safe. And I feel so good offering it to patients because I know you're going to love it and have a great result and nothing bad will happen. Now, I'm going to tell you a little bit about the history of liposuction. It started over 50 years ago in France. Dr. Yves Illouz developed the technique, and they used to just start doing liposuction with the patient under general anesthesia. And when it started bleeding too much, they would just stop. So it was kind of pretty dangerous, and nobody really wanted to do it. But in the 1980s, Dr. Jeffrey Klein was a pioneer in this tumescent technique, which I'm going to tell you about in more detail. Dr. Klein is a mentor of mine. He's and a friend. He's a great guy, very intelligent, and he had a background in pharmacology and in dermatology. In dermatology, we're used to our patients being awake. We don't want to put you to sleep and have general anesthesia. That has a lot of risk, and we're used to talking with patients while we do things. So he put that background to use, and he came up with this concept that we could use lidocaine, when they numb up something, when they remove a little mole or the dentist numbs your tooth for a little cavity, you can dilute the lidocaine by a lot and place it in the fatty layer, and that allows you to do the liposuction pretty painlessly. And he figured out if you put a little epinephrine in that solution, guess what? There's no bleeding anymore. You lose more blood when you have a preoperative lab test than during the procedure. There's essentially no blood loss. So this was his idea. He said, let's put some fluid directly into the fatty space that will numb it up. So we do sedate you during this part. It just feels a little weird, but it's not particularly painful. But once that numbing fluid is in there, then it's numb and we can do the procedure. And because of the epinephrine, any blood vessel will constrict so it doesn't bleed. But also the fat becomes more liquefied, so we can use a tiny cannula versus the large instruments that are still used today by some. So Dr. Klein figured out we could use these very narrow diameter cannulas to remove the fat once we've put that fluid in, and they're way smaller than a pencil diameter. When sometimes they show liposuction on TV or a YouTube channel and they've got a big tube, but that will leave undulations that will have much more trauma. With tumescent liposuction, these little cannulas just make little tiny tunnels in the fat, and then the fat will lower down very smoothly and evenly. So that's why it's so great. There's less trauma, so you're sore sort of for a few days, but you can get back to exercising that first week and drive a car the next day because you haven't had general anesthesia. So it's just easier on you and it's smoother and better. We don't need any stitches either. So we just make a little opening for these cannulas and we let the fluid drain out into some padding, and that prevents bruising. So there's very little bruising even. Now I'm going to show you a few things. Some of the slides I'm pulling from academic lectures that I give because I figure you might want to know a little bit. This shows a view of what the connective tissue looks like under the skin. Fat is kind of like, if it's removed in this view, it would be like grapes around these fibers that you're looking at. If you have little cannulas, they get right through those fibers, remove the fat real evenly. But a large cannula will destroy those fibers and then the skin will sag. We need those fibers to keep our skin attached to the deeper structures. So with tumescent liposuction, we don't have to cut out any extra skin. So we can use the diluted lidocaine, no general anesthesia. The small cannulas keep the skin attached and make a smoother result. And there's minimal bruising and quick healing. Now, who in the audience thinks they're a liposuction candidate? You know, we probably all do. Women in particular, we tend to hate various parts of our bodies because of clothing. We can't wear certain things around the waist, or we don't want our arms to show, or there's something about our legs we don't like. So if there's problem areas that you have, this is what we like to have. You're a good candidate for liposuction. It's not a weight loss procedure. It is for areas that are out of proportion. And this proportion of fat in our bodies is largely genetic and gender related. So you can, thank your mom for the big hips, or somebody else for the big tummy. It's just the way that our bodies are kind of designed genetically. We want the patients to be generally healthy, but you can have high blood pressure or a well-controlled medical disease and still get this procedure, even diabetes. And we do want you to be able to maintain a stable weight. I don't want you to have liposuction, gain 50 pounds. So if you think my weight's been about within a 5 to 10 pound radius for many years, then you're a good candidate. So this person is a good candidate. She's got the bulging of the tummy, a little bit of the muffin top, so that she could have liposculpture and be very happy with it. This patient is like, get out of here. Your body's already perfect. And I do have some patients like that where they perceive that they just want a little bit more taken. Maybe she thinks there's a little fat around the belly button there. Then that would be a good candidate for a non-invasive procedure, which removes much less fat. So we can treat many areas with liposculpture. As Risa alluded to earlier, the neck is probably one of our most popular, and we often combine it with the ThermiTight that other webinars have discussed. Abdomen, very popular, the flanks and the hips, inner outer thighs, arms. Axillary fold refers to these little fat bulges around your arm, the knees, calves and ankles. Some people have just really big ankles, and we can sculpt those nicely, very safely. And the male chest. I even occasionally do the female chest. We can reduce a cup size and without any scarring at all. So it is actually good for a breast reduction if you don't want to go from too many cup sizes down. Then surgery would be better. So at the consult, you come in and we just kind of discuss what areas are bothering you the most, and based on your skin type and how the quality of skin is, I may suggest other areas. Like, well, if you get your outer thighs done, you might feel like your hips are too big. So let's keep everything in proportion. So we kind of discuss it and see what would be best. And we make sure you're healthy enough. And then we would tell you how much it was going to cost, depending if we do 1, 2, or 3 areas. Sometimes we do neck and arms, or abdomen and flanks. So we usually do, a couple areas, not the whole body. It's not safe to do the whole body at once. And in that case, we might divide it into 2 sessions. Then if you call back, I really want to do this, then we have you meet with our nurse, Phyllis, and with a Zoom call, and we can do kind of a little history of your medical background, get you a few prescriptions. We recommend an EKG over age 65, and just make sure you're ready for the day of surgery. And on the day you come in, we give you a little, most everybody's kind of nervous, so we give you a little pill, and then we mark the areas that we want to treat. Usually I have you standing, because standing is when it looks the worst. And I'll mark kind of like a topography map, the areas that have the highest amount of fat, that stick out the most, and I mark the whole area that we're going to treat. I don't just treat the area that protrudes the most, but on the abdomen, the whole area from the ribs all the way down, even that little fat in the above the pubic bone there. Sometimes you get a little fat there. And so we just like to treat the whole area. So if you gain weight or lose weight, the whole thing's going to look great no matter what happens in the future. Then we bring you in the OR, and it's nice to do it we have a fully accredited OR. I have a couple great nurses helping me. We put some music on. We give you some IV sedation because, I don't know, the time will pass more quickly for you. You'll be more comfortable. Some patients don't want medications, and we can do it that way. But I think most people would prefer to have a low medication on board. And you can ask for more later. If you think, oh, I'm getting restless, it's like, okay, let's give you a little bit more. There's a curtain up, so you're not staring at us, but we pump in the IV fluid, and this is what it looks like. I'll try not to show anything that's too scary for you, but after we put the fluid in, it looks kind of like it's full of fluid under the skin. And you can see it's a little whitish. The little teeny bit of epinephrine has blanched all the blood vessels, so there's not going to be any bleeding. Then I will do the aspiration with the little cannulas. I'll make sure to leave a blanket of a small thin layer of fat so it's nice and smooth. I'll hide the little incision sites because you might be in a bathing suit. We don't want anyone to know you had liposuction. I know I've done a good job if no one can tell that you've had it. There's no scars, no irregularities. And we make sure to keep track of from side to side and make everything symmetric as well. So when we're removing the fat, it goes into a canister, and it's just beautiful yellow fat. We like the look of that. That might gross you out, so don't look too closely, but we keep track while we're in the OR. And I can tell when I'm done by a pinch test. I'll sometimes put the cannula under the skin and pinch all over, make sure it's really smooth, or use my cannula like a rolling pin, make sure I didn't leave any lumps or bumps. Do we need to use lasers with every case to tighten the skin? Well, I've shown you with those tiny cannulas, the skin tightens by itself because of the connective tissue. While it heals, it pulls the skin in. And there's many studies that have shown we actually probably don't need lasers in most cases. Sometimes we still use laser-assisted liposuction or radiofrequency-assisted liposuction. This would be, actually, this was a laser case where after we do the fluid, we put a little bit of energy of laser or radiofrequency energy to make sure the skin is going to be tight enough. In someone who's maybe over 65, someone who's had many children might have a little bit of loose skin. So sometimes we tighten the skin as well, but oftentimes it's not needed. Now it's kind of more fun to look at pictures before and after, so that's what we're going to do next. And the different areas. Like I said, under the neck, submental, we call it, is one of the most popular areas. And you can see this woman, she was probably 40-ish, looking a little matronly, people say, I look like my mother or my grandfather or they just see this neck that runs in the family. And you might be like a perfect weight everywhere, but just have the fat under the neck. That's genetic. So we do our little liposuction there. We create definition under the jawline. The skin tightens up nicely. And, right away with one treatment, it can look so much better. Here's another patient who had just no definition in the jawline. We can go up and grab a little bit of the jowl as well with little tiny cannulas and just get this beautiful result. Every time. It's really a nice procedure. In this case, we use the Thermitite, the radiofrequency. You can see that little jowl went away, the wrinkles under the neck went away, and we get everything much better without a facelift. In this case, the patient has to wear a strap around the neck for 3 days. So you stay home for a 3-day weekend. And then Monday, you can go back to work or back into your life. Sometimes there's one little bruise somewhere. And the tightening and the improvement actually happens a little slowly. So people think you look better right away, but this took about 2 months to get to this point. And even in 3, 4, 5 months, it'll get even tighter. So this is a great procedure, very popular in our practice. I went to that course and I came back and one of our nurses said, I'll be your first patient. And this was my very first patient I ever did in 93. And now that's 30 years ago. So you can guess I do have quite a bit of experience. But when I went to that course and I thought, oh, women are going to love this because she hated that abdomen. And I could not believe what we could achieve with these little cannulas and this very safe technique. And look how the skin, which was kind of hanging even, just, rebounded back to the shape of her muscle. So it's even right away, I was able to get good results. And now we're even better. You have to know the anatomy. You have to study this procedure to be good at it. And also I wanted to explain why sometimes non-invasive treatments aren't very as effective. In the lower abdomen, for example, there's this superficial layer, and then there's this deeper layer that's under a fascia. And if you have one of the non-invasive treatments, Vanquish, for example, non-invasive treatments, it can't reach down to deep fat. So it can be a little disappointing. If you can pinch up handfuls of fat, you're really better off. You're going to spend less money if you go straight to liposculpture, because sort of that, again, that attitude, one and done. And it's never, non-invasive is never quite as good as a good job of liposculpture, tumescent liposculpture, because we reach under and get that deep fat. I have the patient on the side. That's how we can reach the deep fat. In one hand, I'm lifting up the superficial and reaching down under that to get the deep fat. And my nurse is providing some counter traction. And then I reach up and I can kind of sculpt the waist this way when you're on your side. So this is another reason not to have you under general anesthesia, because you can turn. You're very comfortable, a little sleepy, but you can turn easily and we can sculpt all the areas. This is a patient who's only 4 weeks out, so we can see the results quicker than non-invasive treatments too. She's going to get even better over the next 6 months, but right away you see at least a 50, 60, 70% improvement in the flatness of the tummy, the waist. She looks just like a much smaller person with this liposculpture. And look, do you see any scars? Not really. So it's very nice. When I'm teaching, I tell new doctors, be very careful in the belly button region, because I see this kind of deformity all the time where they left, we call it a donut deformity around the belly button. They didn't get the fat out. It can be very stubborn there and you have to work extra hard. So that's the type of thing that experience teaches us, how we need to, certain areas where the fat is held on more stubbornly. This is 8 months after, so we want a nice flat abdomen. And look how narrower the person looks. So she can look great in all sorts of different clothing and a bathing suit, which maybe if this June gloom goes away, we'll eventually be back in bathing suits. Who knows? This is another patient. We did tumescent liposculpture on her 3 months later. And I put the amount I removed there, 1,800, almost 2 liters of pure fat. You saw that one container. That's like 2 containers of that. When you do non-invasive, you remove 50, maybe 100 cc's of fat. So you can see the sheer volume that you need to get a nice, a really great result is more than a non-invasive can do very efficiently. You can get there with multiple treatments. Now, I don't usually do really big people like this, but sometimes I do, because this woman, she tried everything and all her fat was right in the middle. And I said, you know what, let's just, it's only safe to remove 4 liters of fat and then we stop. But I said, that's going to make a big difference. And she felt so much better. Then she could exercise more. She was so motivated. And sometimes you just need a boost to start a weight loss procedure. Now everybody's on Ozempic, but when you get off Ozempic to lose weight, you're going to probably gain quite a bit back, or still have a little bulges left. So I think I'm not against Ozempic. I think it can be helpful for patients to finally lose some weight. Sometimes you just need a boost, and liposculpture can be one of them. The hips and the flanks area that you see here kind of below, that was kind of that bigger muffin top, and the waist here we're sculpting it. This patient lived in another state, and she sent me this picture. You can see some little dark dots kind of in the back of her waist, and those are the entry sites, but it's only been 3 weeks. In another 3 weeks, those will be gone. She has no bruising at 3 weeks. Usually all the bruising's gone in 2 weeks, and that's so different than the type of liposuction that's not done with tumescent solution. Patients will be bruised for 2 to 3 months sometimes, but with this technique, there's just not much bruising and quicker healing. This was we do a lot of men too, and you can really, they usually want the love handles done and get just lovely smooth results. When you do the flanks and hips, I always teach people, make sure you feather and blend into the surrounding tissue so that you don't leave a step off and don't be too superficial. Well, look at this patient. Someone kind of gouged out the fat and didn't blend it into the surrounding tissue. Like I said, if you have a good job of liposculpture, you're not going to be able to tell that anyone can tell that you had it. Unlike this patient, it's deforming. And we can help that patient with other treatments, with a little bit of fat transfer actually, and some blending. Outer thighs are another popular area. This is a very small patient, but she just didn't like the way in yoga pants that the outer thigh bulged out a little. So took a little bit out and it looks much better. This patient had a much larger saddlebag. Again, this was genetic. Her sisters, everybody had this. And, you know, she could almost put a coffee cup on that right saddlebag. That's kind of bad. But after one session, you can see the saddlebag is much straighter and better. Liposculpture is not the treatment for cellulite. The skin does look better, but you can see there's still on that right hip, there's still a little bit of cellulite. We have other treatments for that. It helps it, but won't take it away. So we don't want to patients think that liposculpture is the treatment. Now, when we do the outer thigh, we want to be careful to have this cushion, that wedge, right? Not that one, a wedge. That's how it looks when you're standing. And if you don't have that wedge, people tend to take too much out of the outer thigh and create those big, horrible dents. So that's why, again, we want to be careful. We don't stand you up when we're doing the procedure, but we have the cushions to mimic that. So it looks much better whether you're sitting or standing or moving. This inner knee area is an area that happens as we age. The inner knee tends to grow a little bit, and then your thigh kind of looks boxy. So we can sculpt that and get a nice result. And we can do the whole front of the thigh sometimes. This is a patient Dr. Goldman did with the radio frequency or laser and tighten the skin as well. So we use this to reduce, and we can use a tightener with it, particularly for arms and legs. We sometimes do that. And speaking of arms are very popular now, almost more so than legs used to be. But we hate this little bulge around our bra and the way the arm bulges out. And so patients call this the dreaded arm cleavage. And there's definitely something we can do about this. where we treat that fold that's just above the bra. We make the arms smaller and smoother and undetectable, really, in the fact that she's had some lipo there. Now, this patient, you can see it more, that she had a real big bulge on her arm, and now it's much better 6 years later. And on the other patient, the arm in the front is just much, much better and smooth. The arms and the inner thighs, we have to be very careful to leave a blanket of fat, or the arm skin will look crepey. So as we age, we do need some fat there. And sometimes we'll use, for my older patients, we get crepey skin there, and we can use diluted Sculptra, Radius. We can use radio frequency microneedling, tighten devices for the arm. But first, we like to get the bulges in the fatty arms so the fat doesn't look so bad when our arms are out. So, do results last? This is one of the questions patients ask me a lot about. Well, we answered this question in a study in our practice. Dr. Lip was our fellow then. In October 2020, this was published. And we asked patients from over the last 15 years, would you recommend this procedure? Has it lasted for you? How about looseness, firmness, texture? And 85% of patients said they were happy and that they would recommend this treatment. And here's some patients 7 years out. The abdomen is still pretty good. Life happens, and maybe there's a child or an illness or a pandemic. So the first woman's still a little out of shape, but her abdomen is much flatter. Or that back of the waist there is still tight and nice 7 years later. Amazing. Here's someone who's 11 years out on the neck. And what we found, that of all the areas, the liposculpture of the neck lasted averaging 9 years. So it lasts a really long time. You're not going to be back here every year needing another neck treatment. What about long-term follow-up? A lot of patients tell me their friends or someone tells them that liposuction makes you gain weight in other areas. This is true if you gain weight. If any of us gains weight right now, our parts of our body will get bigger. So that happens. But if we can keep our weight sort of the same, several studies have shown that there's no evidence of fat reaccumulation. In one study, though, more recently, they did CT scans. If you don't exercise at all and you have liposuction, the inside fat can increase by 10%. But if you exercise, you're going to not have that happen. So I think one thing here in California, most people are pretty active, and I always emphasize this to patients, that physical activity really helps you from gaining weight. They looked at 34,000 women over a 12-year period. And if you can somehow sneak in up to 60 minutes a day, between running around here and I take a walk with my dog after work, I try to get that in. You can keep your weight pretty good. It doesn't have to be horribly vigorous exercise, but moving helps not only our weight, but our mental status and our brain capacity. So for aging, I think moving is really an important thing. And I encourage all patients who have liposculpture with me, try to keep healthy, move every day, and try to weigh yourself every birthday and stay within 5 to 10 pounds if you can. So just a little bit more about safety with liposuction. Tumescent liposuction is very, very, very safe. There's been no serious complications, death, embolism, shock, blood clots. There's just, a few minor complications that can be handled easily. There was a recent study in 2019. It showed over 25% for studies were analyzed, and the tumescent liposculpture is really the safest. No hospitalizations, heart problems, or anything. So that's why I feel so good about sharing this webinar tonight. It's so effective and so safe. Yeah, there's a little discomfort. Some people have very minor. Everybody has a little bit different tolerance. Some say it's pretty sore that first week, like I did a big boot camp exercise, like I have sore muscles. But within a week, you're feeling pretty good again. You can feel a little tired, have some bruising, but it's not bad. We do like you to wear a compression garment that first week, 24 hours a day for a week, and then during the day for a few weeks. You can get a little surface irregularity or a little collection of fluid, but these are very infrequent and very easy to deal with. We haven't ever had dangerous complications. That's usually related to general anesthesia, doing too much, like having a facelift, a tummy tuck, and liposuction, having too much at once. Inexperienced physicians, lack of following guidelines. There's been some deaths this year I've heard about in cases in Mexico, and one recently in Northern California. So at a spa. So you do want to go to someone who has lots of experience and a very well-trained staff. And in fact, if you're thinking, is liposuction healthy? In another study showed that if you have normal triglycerides, liposuction doesn't change it. But if they're high, it'll actually help the triglycerides in your bloodstream and keep you very healthy in that regard. So when do I prefer tumescent liposuction over non-invasive options? If you just have a little bit, I've actually done some cool sculpting. My arm wasn't too bad. And so a little, if you just have like a little bulge, it's easier. And we have a great staff and great techniques for that. But if there's larger bulges, if the whole abdomen is full, or the neck, I think the neck is really better to handle with tumescent liposuction with or without the thermi or laser tightening. And if you need results quickly, like I've done some women who want to fit into their wedding dress within a month, then we can do tumescent liposculpture. That result is going to happen much more quickly, all at once, and just so nice. Now I'm not going to talk too much longer, but I want to talk about recycling the fat and transferring it into the face and body, because when we're doing liposuction, we might as well use that in other areas. So where are areas that I transfer it? Into the face, the cheeks, the temple, the chin, the jawline. The hands are very popular because our hands will get aged looking, and the fat is wonderful there. We can do fat into the buttocks. In our practice, we don't do the Brazilian butt lift, the really large buttocks. For that, I would refer you to some plastic surgeons. That's a more involved procedure, more risky. And sometimes I use fat to smooth out skin for trauma cases or people who've had bad liposuction. And this fat transfer has been performed for over 100 years. It was first done on a ballerina years and years ago. And it's nice because fat is, you're not allergic to your own fat. It's safe in all areas of the face. And fat actually does contain some stem cells and growth factors, so it helps the quality of the skin. It helps scar areas heal faster. We have on our faces now a layer of superficial fat that's like a blanket, and it gets smaller over time, and it diminishes and atrophies, leading to some sagging and wrinkles and depressions. And then there's a deep layer of fat under the muscle near the bone that projects our cheeks forward. And so when that atrophies, our face will sort of slowly deflate and descend into this characteristic sagging. So that's why we like to replace the fat or replace volume, because it makes us look younger. That's the way we age. So if we replace it, we can do some rejuvenation procedures very naturally. So why would we need fat transfer? We've got a lot of fillers, and in fact, fillers are much more popular now in my practice. They're frankly easier. But if we're doing lipo, then it's convenient. Sometimes I see a patient, I think, oh my God, they're going to need 20 fillers to correct this problem. Then fat is more cost-effective and a better option. Some people have allergy problems. The fat does last longer, but it's not actually permanent. So a lot of patients think, oh, I want to get fat because it's permanent. It won't, it does diminish over time. And so I think that's not a bad thing. Some patients might do a fat transfer procedure in every 2 or 3 years instead of fillers are more often. And maybe a patient has a lot of allergies, so they want to use fat. For scars, burns, trauma, and disease, I do love fat for that. We have to pick the right patient, harvest the fat, take it out. Then we centrifuge it, we process it, we clean it, we size it, and then we put it in. For example, we've shown, this is a study I did in 2002, that if I centrifuge the fat, it's going to last much longer than if we don't centrifuge the fat. We know that if we transfer the fat into little syringes and put a little string of pearls, we call that, inject those pearls, that is a smoother result. It requires, it avoids bumps, and it survives better, and there's less pressure, so it's safer. So that we transfer our fat into those little syringes, and we can get a result like this in this very gaunt face. That's almost 22 cc's in that face. And then 8 months later, it still looks pretty good. A little bit has diminished, but whatever lasts for 6 months will pretty much stay. This patient, we didn't put any in her lips. I don't think fat stays well in the lips. There's too much movement for it to develop a blood supply. But if we frame the lips look prettier and they're supported. And we can shorten the distance from the nose to the lip to some degree by doing this. And this is, again, 22 cc's of fat. This patient had an accident and had trauma to the face that we're able to, with 2 sessions, balance the face. She had had multiple surgeries and didn't want any more, so we're able to balance the face with some fat. And I did put some fat on both sides to just rejuvenate the whole face. But you can see the skin quality, it glows after a fat transfer. So when I have patients that I've been doing fat transfer for the last 20 years, their skin looks amazing. We often use it at the same time as we do liposculpture. I published this about 20 years ago, by taking that fat out from under the chin and putting it into the chin like a natural chin implant. It pushes that recessed chin forward and creates an even better jawline. And you see it here as well. This is someone who had a full face done. Fat is not for the little wrinkles around the mouth, it's too thick, but it's for rejuvenating the whole face. And it's nice around the eyes, and we can lift the brow and again help the skin quality. For scars, this is some scars from surgery. It's great for scars. And this is after we've harvested the fat. Now I'm going to push it through this sieve and create smaller particles of fat that we can use as a blanket for crepey skin or for damaged burned skin. So this can be a very nice thing to do when we process the fat and we size it through that syringe. This patient had an injury on her wrist. You can see the tendon there. And so I used macro fat, the thicker fat, for the deeper defect, and then the little micro fat to smooth out the skin. So I love layering the fat like this. And we do see this is over 2 years since her 3rd fat transfer. So after a while, we do get some permanence. And that was over some period of years. So in summary, for fat transfer, in some situations, I really love it. I think the stem cells help injuries a lot. There are rejuvenated properties for the skin. But it actually, usually the synthetic fillers, the Voluma, the Wrestling Lift, the Sculptra, the Radius, usually those are going to be more cost effective because we're not needing so much. Unless we're already doing your liposuction, then we like to do both. So now I'm going to open it up for any questions that you may have. And I hope someone has a few questions.
Amazing. Thank you so much, Dr. Butterwick. I hear everyone clapping. That was extremely comprehensive. I am just going to remove your screen here so everyone can see you while you answer your questions. So thank you so much. That was amazing, and only could be done by someone like you that's been doing this for longer than I've been alive.
Oh, are you under 30? Good.
Okay, fine. Anyhow, this is the time for question and answer. So everyone, please feel free to pop any questions that you have in, and we will get started. All right. So this is an interesting question. Can you save the harvested fat? And if so, for how long?
Well, we have been able to save it. We had a certified tissue bank in our office for many, many years, and we would freeze the fat. And I showed studies that the frozen fat worked well and had stem cells in it. However, just like some things change, not always for the best, they have changed the requirements, and it just is too cost prohibitive unless you're a big hospital to have a tissue bank anymore. So the regulations on that don't allow us to save it anymore. There were some companies that we could send the fat to them and they would save it, and they're all gone as well. So I guess fresh fat is actually a little bit better, and it's not a big deal to harvest more fat if we need it. Most people have a pretty good supply of it when we need it.
That's true. I was going to say, I wouldn't mind if you just took more out. All right. And now we have tons of questions. Thank you all. Okay. So do we have any images, or do you maybe have any stories about fat transfer, after 3+ years out?
Well, I showed that one patient, she was 25 months, so over 2 years out. And so I have several patients that have been many years out, and they do tend, the best place for retention is the center of the face and the temples, this whole kind of upper face and jawline. Because of all the movement around the mouth, that's the least that's the worst place, I should say, for fat retention. And that's easy to use synthetic fillers. So we'll often combine the two. So that we do have 3 years and more, sometimes 5 years. But most patients, even if they've had fat transfer, maybe 5 years later, we'll just do a couple syringes of regular filler. I will say that you don't want to overdo it with fat. We've seen those people from Hollywood that are really sort of gross, overblown, overfilled people. And I think some of them had fat transfer and now are 50 pounds heavier, and their face, so you don't want to really overdo it with fat. I don't use more than about maybe 40 to 50 syringes would be the most I would ever do. Some physicians put in 100 or 200. I think that's too much, because you never know what your weight's going to do over a lifetime. We don't really, patients ask me for permanent fillers all the time. You don't really want permanent fillers. The bone changes, our weight changes. So it's okay if you have to reduce something, a little bit of volume. I think it's more natural and avoids that overfilled syndrome.
Great answer. All right, 2 questions about this, and I personally am excited to hear the answer too. Can you do fat transfer into the breasts?
I knew that question would be asked. In our practice, we don't really do that. And the reason is, some years ago, they've shown that the fat transfer in the breast can occasionally calcify, make little tiny calcifications. But guess what? That can show up in the mammogram. So it could mean that every time you go to get your mammogram, it's going to be positive, and yet another biopsy and all the worry that that would involve. Now, a good radiologist can tell the difference between one that's from fat and one that's from cancer, but can they be 100%? You'd still be kind of nervous without a biopsy. So fat transfer is done for the breast, but particularly in women who have had breast cancer and undergoing reconstructive surgery. And I refer those patients to some great surgeons in town. So that's not something that we feel we should be doing. That should be done by a reconstructive breast surgeon. So it's important that your doctor knows their limitations. And that's an area that I think belongs in that realm.
Oh, all of us that have had kids here.
No.
That's
Yeah, I
okay.
wish that was good because it would be so natural. However, it is safe to do a fat reduction, a breast reduction with liposuction. If you want to go from like an E to a D, or not too many, 1 or 2 cup sizes down. You can't go from a triple E to a B. Then that needs surgery.
That is so interesting. Thank you. I learned something new. All right. So you mentioned, that fat transfer isn't good in this area. So that means we don't re-inject fat around the mouth or the jawline.
Well, no, the jawline, yes.
Oh.
The lips, I mean, you can do the lips, and you have to overfill the lips. They look kind of ridiculous. The family sort of teases you for a week or 2, and then it goes down faster than a filler. So I think when I do fat transfer, will often put like a Juvederm or some other filler in the lips. That's a nice combination. But you see, when we're putting fat in, blood vessels have to grow in. It's a transplant, and like you're planting seeds, it has to start growing there. And if it keeps moving, it keeps tearing away the new blood vessels. And so it's harder for fat to survive there.
Okay. Oh my gosh. We have so many questions and a few minutes left. We'll get to the most important ones. So how long does a typical procedure last? Take to do?
How long? The liposculpture will depend on the areas. It's a little slower than the old method with large cannulas, because it's like trying to vacuum with a small little vacuum cleaner. You can get every nook and cranny. It takes a little longer, but there's no post-op problem. So the time is well spent in the OR. So that will take us usually all morning if we're doing multiple areas. For the fat transfer, that's pretty quick. It can take as quick as a half hour to do the harvesting and the fat. So that can be pretty quick.
And so how soon after one of these minor, liposculpture to say your abdomen or waist, can you return to some low impact exercise?
Well, I remember one patient, she sent me an email. She said, I ran 5 miles and it was like the 5th day. Most people are not like that. But I like you to start walking the next day. Because walking, actually, sometimes I see people and they have like no swelling, and they're all walkers. So walking is the best exercise. Low impact, you can start that first week. Usually the first couple days, I think you should plan on being pretty sore for about 2-3 days, where you walk around the block, but you don't really want to go too far. But then a lot of people go to the mall the next day. And I'll tell them, do not buy any new clothes for at least 6 weeks, because you'll be having to buy more new clothes.
Good point. All right. Are there any treatments for sagging skin that can complement tumescent liposculpture?
Oh, yes, for sure. And sometimes we do them during the liposculpture, like the radio frequency, the thermi-tight can be done on the arms, abdomen, neck. it's really, really great on the neck for that. But sometimes we think, okay, let's just see how much tightening you're going to get with the liposculpture. And then later we can do Ulthera or Thermage or our new soft wave ultrasound device to tighten the skin further. The place that is a little tough to tighten the skin is the upper abdomen. We want to leave a little blanket there, but sometimes, you know, a few months later, we might use a Thermitight or Thermage or Ulthera there. So that would be the main area that we do, or sometimes the knees. So usually we get pretty decent tightening with just liposculpture alone. So it's kind of nice that we often just wait and see. And if it's not tight enough, then we have several treatments for skin tightening.
I love that because, you know, you could just as easily tell someone they need to pay double and do them both at once. It's
right.
so great.
You want to be cost effective in these days.
Absolutely. Okay, so we have so many questions left. I don't have time to get all of them, but a lot of people are curious about cost. Is there anything you can tell us, like what this starts at or range or anything?
Oh gosh. Well, it'll probably, I don't know. Should
Okay, so how about this? Maybe what we can do is if you have questions about cost, you could contact the office and because there's so many questions coming in about cost. Some people asking about chin, some people asking about, you know, waist. So maybe we could.
I think, well, let me just give a range.
Okay.
Like let's say the least it would cost is probably about 3,000 to 4,000, and the most, if we do a lot of areas, that can be up to 12,000. So there's a range depending on what we're doing.
Got it. But all far less
for,
expensive than plastic.
It's best to come in for a consultation, and we'll give you all the costs at that time, and you can really see if that's something that you want to do. And I think that this is an area that you don't want to go to the cheapest place, because those examples are from the cheapest place. I mean, you want someone, and again, with experience and with the staff and the expertise, really does matter for this procedure, and especially with fat transfer as well.
Absolutely. Absolutely. Well, thank you so much. For everyone that we didn't get to your questions, I am so sorry, but we're going to take, I took copies of all of them and we'll try to get to them on social media. So please make sure you're following us at Cosmetic Laser Dermatology on Instagram, because we'll try to answer these questions. And maybe we'll have to do a follow-up.
Lisa, we should do that on Instagram. I can answer some of the questions there.
Perfect.
Yeah.
Great. Okay. So everyone make sure you follow us on Instagram, and we'll try and get that done with Dr. Butterwick, maybe as early as tomorrow, depending on, she has a packed schedule right now, but
yeah, don't, or maybe the next day. Okay, great.
Okay. In the next couple of weeks,
everybody. I appreciate you tuning in and listening. Thank you.
Yeah, I really appreciate everyone tuning in. 2 of you that stayed on to the end now are going to win $500 towards a liposculpture or fat transfer procedure with Dr. Butterwick. So I will be running a random selection right after this, and we will notify you tomorrow. And if you're comfortable with it, post it on social media and hopefully get you all scheduled. Otherwise, I know it's after hours now, we're not answering the phones, but you can always go and book online if you'd like to do a consultation with Dr. Butterwick or with any of our amazing dermatologists. And Dr. Butterwick, we really do appreciate your time. I know Dr. Butterwick saw tons of patients today and did all these treatments, and I'm sure she's exhausted. So I appreciate you taking the time to educate all of us this evening. And for everyone that showed up, we all had crazy days too, working or being a mom or whatever you were doing. So thank you for coming and learning, and I really hope that we get to meet you soon, and we'll see you guys all on Instagram for the rest of the questions. Thanks, Dr. Butterwick.
Thank you. Thank you.
Bye.
Bye.